Hi, my name is Dr. Eric Bingham. Welcome to this webinar today, and I'm with Utah Valley Pain Relief. I'm a chiropractic physician, and today I want to discuss with you and talk to you about a new therapy that treats chronic neuropathic pain. In this webinar today, I'm going to discuss a few of the frequently asked questions about Calmare therapy and how you may be qualified to be able to come in and see if you have any of the conditions that we do treat. So first of all, I want to start off with talking about what Calmare therapy is. Calmare therapy was started back in Italy about 12 to 13 years ago, and about 4 years ago it came to the United States. So it's a relatively new therapy in the United States. With chronic neuropathic pain, a lot of ways to treat that has been more medically with injections and drugs and those type of things, which are very difficult to treat chronic neuropathic pain. And it hasn't been up until now that we've had some fantastic results with this new therapy called Calmare therapy, and we've been able to help a lot of people with these horrible chronic conditions. So some of the conditions that we do treat, I'll go through those briefly, and then we'll talk about the Calmare and how it helps you and how it helps with the pain. So the first one is basic neck and back pain. If you've had neck and back pain for more than 6 months, where it's a consistent pain, never goes away, not so much arthritic pain, but just a constant burning pain that never gets relief, that's the type of pain that this type of therapy treats. Another type of condition that we treat is chemo-induced neuropathies. This is where a cancer patient is going through chemotherapy, and they are taking the chemo drugs, which are very caustic and irritant to the nervous system. And a lot of these patients will develop this burning type of sensation or tingling in their hands and feet. There's actually studies going on at the Mayo Clinic and in Boston and the Massey Cancer Center and Johns Hopkins. And these studies have been going on for 4 years or so on chemo-induced neuropathies, and they're having great success with them. A lot of those studies are actually published at this point. We treat neuropathic pain. A lot of patients ask, how do I know if I have neuropathic or mechanical type of pain? Mechanical pain would be a pain that you move a certain way and it hurts. But for example, a knee. If you sit down, your knee doesn't hurt, but when you stand up, it does hurt. That's more of a mechanical nature. Neuropathic pain is more of that constant nerve type of pain, like sciatica, the pain running down the back of your leg, or peripheral neuropathies, where the pain is in the hands and feet, and more of a constant burning, tingly type of sensation. There's post-shingles pain. So patients may get shingles, which is a very painful condition anywhere on their body, and normally goes through a series of symptoms for a period of time, and then those symptoms go away. Well, in some patients, they develop this chronic pain that shingles pain continues to stay, and even though the acute symptoms went away. So this is called post-herpetic neuralgia. We also treat reflex sympathetic dystrophy, or another name is complex regional pain syndrome, or CRIPS. Anything that's nerve related, this has a great potential to be able to help a patient. So what is this therapy? It's a therapy. It's electrical therapy that we place surface electrodes, EKG electrodes, around the pain area, and the machine essentially retrains the brain to turn the pain off. It's sending 16 different non-pain signals to the brain, and through a series of treatments, an average of 10 to 12 treatments, they were able to turn that pain off. And in some cases, it turns it off for good. It doesn't come back at all. In other cases, a patient will have to do a booster type of treatment where they'll come in, the pain may come back in 3 to 4 months, and we'll do 1 or 2 treatments, and it knocks it back out again. The great benefit of this is there's no side effects. It's drug-free. It's non-invasive, and I can't believe the success that we've had with this type of therapy. We've been doing it for about 2 years in our office and having some phenomenal results with it. And so, if you want to come and try it, I'd love to talk to you. Again, my name is Dr. Eric Bingham, and I'm with UtahValleyPainRelief.com, or Pain Relief, and you can also look at our website, UtahValleyPainRelief.com, if you want to answer any more or need some more of your questions answered. I'm going to wait for just a minute or two to see if there's any other questions in the webinar. If you do, I'd be happy to answer any of them. One of the other questions it looks like came through that, what are some of the reasons why treatment may not work? If you have a pacemaker or a defibrillator, we can't do the treatment on you. If you're pregnant or breastfeeding, we will not be able to help you with the therapy. Also, if you suffer from seizure or epilepsy, those are another couple conditions that we can't help with. Let's see, a couple other things. If you've had a heart attack in the last 6 months, if you have a drug-implanted delivery system that's currently working, or a spinal cord stimulator. So those are contraindications to the therapies. And so, if you call our office at 801-922-4310, we'd be happy to answer any of those questions for you, see if you're a good candidate. We have patients that come from all over the country, come from California, Nevada, Colorado, Idaho, and these western parts. Just got finished up with some patients in New Mexico, from New Mexico, and even St. Louis. So, we have patients come all over, and we've tried everything, to get rid of their pain, and been very unsuccessful. But they've come here, and we've had great success with them. So, the therapy is not painful. It's pretty comfortable, considering people come in at a pain level 8 or 9 out of 10. It actually feels pretty comfortable to them. Another contraindication I just thought of is, if a patient's on nerve compressant drugs like Lyrica, gabapentin, Neurontin, any of those are actually inhibit the Calmare therapy, because they do suppress the nervous system, which the therapy that we do acts like a nerve, and as it's traveling through the nervous system, if you have those drugs in your body, then it inhibits the effectiveness of our machine. So we have people wean off of those. We do want you to talk to your primary care physician before you come in, as far as weaning off of those medications, so that we have the best chances of being able to help you and make it more successful. Just seeing if there's any other questions out there. So another question is, how expensive is it? We offer a free consultation and first free treatment. You come in and we can hook you up to the therapy machine, and we can usually tell from that very first treatment if you're a good candidate. And the way we know is if it turns your pain off. If you get no relief from the first treatment, chances are you probably aren't going to be a good candidate. And so we can usually tell from that first visit. You don't have to go through the 10 to 15 treatments to see if it is going to be effective or not. I can usually tell you from the first visit if I think it's something that's going to work when we move forward. If it doesn't, then I'll be upfront with you and let you know. We only want to help the people that we can help. So give us a call and let us know, and we'll get you in for that free treatment, and you can try it out. All right. Well, it looks like I don't have any other questions, so just give us a call when you'd like, and we'll go from there.